one of the problems with rhabdomyosarcoma is that even when it's hasn't spread at first diagnosis, is that the biggest problem is that it comes back where it first started. I mean, it can spread, but the biggest problem is it can just come back where it first started. So the surgery and the radiotherapy that we use to start with may not be adequate to treat with what we call local therapy. So there are a number of different approaches to that. And then in some patients, it will come back with disease that's spread. And there we need a different approach, which is more what we call systemic therapy treatment that treats the whole body. So there's some really interesting work that's being funded through the Royal Marsden Cancer Charity that's looking at the effect of drugs that can potentiate the effect of radiotherapy in children with rhabdomyosarcoma to see whether we can reduce the risk of the tumour relapsing by, if you like, improving the effect of the radiotherapy in treating the patients in the first place. Our colleagues, laboratory colleagues that we work with closely, are trying to understand the cells that will, if you like, not be affected by the initial treatment, the stem cells that may remain in the body and then pop back up with rhabdomyosarcoma. So we're looking to identify those cells, and if we've identified them, we can then understand what makes them tick, if you like, and what molecules they express and how we could then target them in the future. And other colleagues around the world are interested in approaches like immunotherapy, CAR T-cell therapy in rhabdomyosarcoma to see if we can either treat disease better in the first place when it's very high risk, or to treat it at relapse. So there's just a few examples. And then, of course, there are multiple studies going on looking at specific targeted therapies. So we do have other treatments here in our drug development unit and across Europe and across the world, which are looking at specific targets that are found not only in rhabdomyosarcoma but in other cell types that can help us to target rhabdomyosarcoma better. And the whole sort of molecular profiling work that's going on now through Genome England and through studies like the StratMed Peds, which is a UK study, again, with leading from the Marsden and Institute of Cancer Research here with Great Ormond Street Hospital. So we now are able to understand the molecular features of rhabdomyosarcoma, both at first presentation and also at relapse. And that helps us to be able to identify particular features of the rhabdomyosarcoma that we might be able to target specifically with the drugs that exist. So there's a whole bunch of different approaches that are going on. It may be not one size that fits all. We might need different approaches for different individual patients, but we're hoping to, if you like, increase our armamentarium so that as time goes on, we are able to both treat the whole population of relapsed rhabdomyosarcoma patients better, sort of with a more generic approach, but also where we can to target specific patient tumours with individualised, more personalised medicine approach.